The vulnerable population I decided to present about is the homeless adult population. Homeless single adults consist of the largest portion of the homeless individuals. African Americans account for 40% of this population in total, which is largely disproportionate to their representation in the general population. Single adult homelessness is often brief and non-reoccurring, unlike other groups that face homelessness. Those facing poverty are more at risk for becoming homeless. There are three types of homelessness, and the first is chronic, second transitional, and third episodic. Chronic homelessness is described as those that seek shelter as a long-term solution and not an emergency situation, and they're often unable to obtain a job due to illness, disability, or a mental illness. Transitional is what most homeless single adults fall under. It's usually after the loss of a job, or younger people, it's them moving out of their parents' house, breaking up with a significant other, losing a job before becoming more and finding more stable living situations. Episodic is when somebody is chronically unemployed, usually facing medical or mental issues. Population size. Locally, Salt Lake City has about 10 out of 10,000 people being homeless. Statewide, Utah has an average about less than 10 out of 10,000. The United States as a whole is about 17 out of 10,000 on average being homeless, and globally the homeless population is over 100 million. Factors that play into Utah having a lower homeless population than the U.S. is lower cost of living, meaning less people are getting kicked out of housing and can't afford housing. A low tolerability of sleeping on the street, which we've all experienced. Utah's weather, a lot of the time it's cold or raining or snowing. It's just not a great place to be living outside in. And then lastly is the supply of homeless shelters or the lack thereof. Social determinants of health that are barriers to homeless adults are all of them. All 5 of these key determinants are often unmet in homeless adult populations. The first being the lack of economic stability. Many homeless people do not have jobs or cannot keep them. And then second, many communities are not equipped or necessarily supportive of unemployed individuals or homeless populations. Just like in Utah, Salt Lake is the hub for homeless populations. Other cities, counties actually send people to Salt Lake because they have the resources there. As stated previously, many homeless adults cannot establish a primary health doctor or keep appointments, and follow-ups or prescriptions are difficult to enforce due to the lack of permanent address. Many homeless people are forced to sleep on the streets or in parks, which is unsafe, and they're prone to weather conditions and also other individuals, since they do carry most of their belongings with them. There are many things that affect homeless adults disproportionately when compared to the general population. An obvious one being poverty, given that those who suffer from poverty typically face homelessness at some point. There are many environmental factors which they face more than the general population, such as temperature extremes as they sleep outside or exist outside mostly. As mentioned previously, they face increased safety concerns as well, since they carry and sleep with all of their belongings on them, makes them targets for assault or violent crimes. Shelter, they often lack the resources to house shelter or find it, as well as space. There is also a higher incidence of substance abuse in these populations, and a general lack of access to health care. The root cause that I discovered by asking the question, why are homeless adults more vulnerable to health disparities, is just a lack of access to regular health care. They are unable to receive the preventative health care that would catch diseases earlier or prevent certain events from happening. Due to the unavailability of this type of care to them, they usually are very high utilizers of the emergency medicine services. According to Maslow's hierarchy of needs, almost all of the basic needs are unmet in this homeless adult population. Sleep, food, and water being the main ones. Because of this, their anticipated functional level is pretty low. If you're unable to meet your basic needs, you cannot attain higher functioning levels, which results in poor health, poor relationships with others, a lack of shelter or safety, and they're just unable to achieve the higher levels, such as like higher self-esteem, career, stability. This population is more at risk for communicable diseases such as influenza, COVID-19, which is a new one, tuberculosis, HIV, hepatitis, and STIs. Some factors that contribute to this incidence are close quarters. When they're in shelters or on the streets, you often see homeless populations gathered together in similar places, swapping, sharing things, sharing the same space. Also, a general lack of access to maintaining their own hygiene and drug and substance abuse. I think a great way to reduce these diseases from transmission would be more public access to showers or soaps, toothbrushes, toothpastes, anything to help with the hygiene and could prevent the spread of some of these. I think free health screenings at shelters should be offered, just because most homeless people at least stop by a shelter once in a while for care, and if they had a free health screening, then maybe that could be their slight preventive health care. I also think sharps containers in public areas can reduce needle reuse by these populations. I see them a lot in more concentrated areas like California or New York, but I think that they could be useful in these situations as well. Homeless adult populations are also at higher risk for non-communicable diseases. As mentioned in a lot of these slides, it's mostly due to lack of preventive health care and medicine. It's also influenced by the lack of proper nutrition and improper sleep and exposure to environmental elements that the general population is not. Mental health presence in the homeless population is about 60%, which is double from the general population's mental health presence. Skin damage or infection, often cold exposure related, is seen in this population, as well as it can be influenced by like if you get your socks or shoes wet, they don't have extras to replace it, causing skin problems. Diabetes, heart failure, stroke, heart attack, and dental problems are also diseases that they face at a higher incidence, simply due to the fact that they do not have access to medicine or the preventive care to assist them in managing those illnesses. 90% of homeless populations from a questionnaire given out stated that they do not have any form of self-care at all. And then also suicide rate is more than double in homeless individuals than it is in the general population. This is mostly attributed to the experience of mental health issues that go untreated, which can largely attribute to this. Lastly, a survey was done in Maryland regarding violent crimes. Almost 50% of surveyed individuals stated they've been victims of crime while being homeless, with 62% witnessing other homeless individuals being victims of violent attacks from other individuals that were homeless. Substance abuse and mental health problems were associated with higher incidence of violent deaths in this population.